Before going into the topic details, I want to bring your attention to the UPSC coaching programs offered by ClearIAS. ClearIAS offers online and offline courses to help candidates get selected for prestigious government services like IAS, IPS, or IFS. ClearIAS, Prelims cum Mains, PCM course, provides a highly effective study plan, well-organized subject-wise videos, study materials, mock exams, and guidance to cover the entire GS syllabus of UPSC CSE Prelims, Mains, and Interview systematically. As a limited-period offer, there is a 40% discount on our online courses. Enroll now.
The Indian industry actually recently found out, or you can say innovated, a particular vaccine for the hepatitis A. So which is the disease actually hepatitis A. For that particular disease, we actually discovered a vaccine. And who discovered? It is not from the government sector. It is the Indian Immunologicals Limited. That is the particular agency which actually created or invented this particular vaccine. And the vaccine's name is actually Havrixure. So again, this is a screenshot from the newspaper, Financial Express. So what is the particular vaccine? Havrixure. So that is a prelims point. Recently, one particular, a vaccine was actually discovered. They can ask you simply that it is for hepatitis. They can create a tricky question that they can say simply that a particular vaccine was created for hepatitis C. That is another type of statement. But, so I'm not saying that if it is A or B or C, do you have to remember? Yes, you have to remember because there is no vaccines available for hepatitis C. That is the point. That is the tricky part. So there are different types of hepatitis, A, B, C, etc., like that. Out of that, this particular Havrixure was invented for hepatitis A, while hepatitis C does not have a vaccine at all. That is the point. So when we say that it is actually hepatitis, why we have to talk about hepatitis? Because there is actually almost 1.5 million deaths are actually happening in the global level. So in the world also, every year 1.4 million deaths. 1.4 million means 14 lakh deaths are actually happening. So it is definitely a huge issue. And this Havrixure, it is actually for the pediatric use actually. Pediatric means for the children, for the kids only. So for this particular Havrixure, it is for the pediatric dose. And why this Havrixure is so important? Why we are discussing this topic? Why this topic is important is because that this particular vaccine is the first indigenous hepatitis A vaccine in India. That is the first indigenous. It is the first indigenous. Indigenous means we are creating out of our own. We are not importing. So it is the first indigenous hepatitis A vaccine of India. That is the importance of this particular invention. And you have to also note that India also has a huge share of the burden of this particular disease. So we'll understand what this particular disease is actually all about. And we already mentioned these 3 points, that it is a Havrixure, it is pediatric, and it is actually indigenous. So we move on from the particular thing. What is this thing called hepatitis? So we can briefly say that what is hepatitis? It is actually the inflammation of which organ? It is actually inflammation of the liver. So that is the point. Liver is the largest organ in the human body, and this particular disease is actually affecting the liver. So it is causing an inflammation of the liver. That is the primary point. And how this particular liver is actually being affected? It is actually being affected in multiple ways. So what are the different types of ways? We have to understand only about the peripheral things. We are not trying to be MBBS doctors or any gastroenterologists, nothing like that. So we'll just understand the very brief things because it is actually in the news. Only because this particular thing is actually in the news. So when we think about the liver issues and actually all the things, there are 2 types of liver inflammations, we can say. From that healthy liver part, we can understand that there is acute inflammation can be there, chronic inflammation can be there. So I'm creating a prelim statement that is, there are 2 types of inflammations, acute and chronic. So we can say that this acute inflammation, it is actually reversible. So when if it is actually reversible, which means that it is actually for a very short term also. So when we deal with acute inflammation, 2 things, it is not easily, with medicines and all, it is comparatively easily reversible, one thing, and it is for a very short period of time. This is the 2 things. And when we think about chronic inflammation, yes, it is definitely reversible, but it takes more effort. That is one part. Second thing is that it is actually a very long-term issue. So this chronic inflammation, chronic what is hepatitis is actually a long-term issue, and this acute inflammation is actually because of some immediate issues and all. This is a short-term issue. That is the point. Acute and chronic inflammations are actually there. So they can create a prelim statement, right? So this acute inflammation, which is caused in the liver because of hepatitis, it is not reversible. No, it is reversible. This what is a chronic inflammation is actually a short-term inflammation, while acute inflammation is a long-term. So when we hear the word acute and all, we might actually tend to think that okay, acute is actually long-term. No, acute means short-term, chronic means long-term. So this is the way they create tricky statements for the prelims. So that is the point. So these are the different types of inflammations, and then further, if there is any other underlying conditions or any other things and all, the liver may get other diseases such as cirrhosis, and it may get completely damaged and all. So I don't think UPSC will ask you that much medical related questions, but the very basics we have to keep in our mind. And how this hepatitis is actually being so spread and all, you can say that it is actually mainly because of the different types of viruses also there. It can also spread. There are many other ways in which this particular disease is actually spread. Now, my point is, how many types of major hepatitis are actually there? We can say that there is hepatitis A is there, then B is there, C, D, and E. So A to E. So there are 5 hepatitis A to E, A, B, C, D, and E. So out of this thing, we have to understand that one particular hepatitis does not have a vaccine, that is C. So which means that there is no vaccine for C. Again, UPSC can create a very tricky question out of this thing. Recently, or there is actually vaccines available for hepatitis C. Or recently, Havrixure was actually invented by the Indian researchers and all. It is a medicine, it is a vaccine for hepatitis C. So that one particular alphabet may change the answer of that question. So that is the point. C does not have a vaccine. The vaccine is actually now created for hepatitis A. I hope that it is a very important part which you should not actually forget. Now, there are different ways in which these diseases are actually spread across. For example, hepatitis A, it is actually spread through contaminated food and water. So with the contamination of food and water, if you are actually drinking that water or eating that, having that food, in that way it can actually spread. Hepatitis B, it is transmitted through contact with direct body fluids or sexual contacts. So if there is any contact with the body fluids, or if there is any sexual contact like that, it can spread through that. So that is the way in which B is spread. So while A is actually because of the food contamination and all, B is because of the sexual contact or the contact of body fluids and all. So when we come to hepatitis C, it means that it is contracted when contaminated blood. So that means contaminated blood enters the bloodstream of an uninfected person. So it means that through the blood actually this hepatitis C is actually spread. Through the blood, hepatitis C is spread. And D can only be obtained when a person already has hepatitis B. So if I have hepatitis B, then I have a possibility of getting hepatitis D. That is the point they are actually raising. And last one is actually E. It says that spreads through contaminated food or water and is commonly experienced by frequent travelers. That is one point they are actually raising. The A and E are actually having a very similar cause, that is contaminated food and water. However, they are actually adding that those who are actually traveling, those who are actually eating from here and there, of course, I'm just like that. So they are saying that we have to be really careful, because then they have a higher chance of getting such things. So wherever you go, make sure that you eat hygienely. You can go eat the street food, you can go explore the food and all the things, but make sure that the place is actually hygiene, the food is hygiene before having it. That is the point they are actually raising. And this is the way in which the different types of hepatitis are actually spread. So make sure that this is bloodstream, this is body fluid and contact, and these two things are food and water. And what is the specialty about D? You can have D only if you have B. That is the point. And also you have to understand that there are different causes. For example, if you have underlying cancer, if you have some kind of liver cirrhosis, that is a disease which is affecting the liver. So these kind of things are actually that can act as a common cause for this kind of issues. And we have to also understand that out of the entire hepatitis global burden in the world, just like I said, there are 1.4 million deaths globally. We already mentioned that. So out of the global deaths, or we can say out of the global infections, we can say that the hepatitis A and hepatitis E combined together to give only 5% of the hepatitis. So it is actually very less percentage or proportion, we can say. So who is actually taking the major chunk? We can say that it is actually C, which has around 48%, and B, which is actually having 47%. Again, you don't have to remember the numbers, but just keep in your mind that vitamin C, sorry, not vitamin C, the hepatitis C and B, which are actually having the major chunk of the proportion of the hepatitis. The A and E are considerably less. Again, you can create another film statement like that. Out of the total world burden of hepatitis, it is actually, what do you say, this A as well as E, the hepatitis A as well as E, that are actually having a combined burden of 90%. No, it is not like that. A and D combined together only 5%. C and B has the major issue in the hepatitis daily. I hope that is the way in which UPSC creates a question. So my request to you also is that whenever you encounter, whenever you read any topic which is relevant to the UPSC, make sure that at the very same time in your mind create a question out of it, create a prelims question, create a mains question out of it. So think like that, how a question can be created out of this thing. 100% sure UPSC will not ask you the very exact question, obviously, but you'll be anticipating how a question can be framed. And when you're actually entering the exam, when you're actually getting the question paper, you will be less surprised because you have already anticipated different kinds of scenarios out of the very similar topic. So it is actually from the experience. We try to do the simulation game. That is, whenever we take a topic, whenever we read a topic, we try to do the simulation game, how questions can be framed. Obviously, around 40%, that is the 40 questions out of prelims, you will be knowing. Rest of the 60 questions, that are actually the difficult part, we can say. So out of the 40 questions also, we'll be very surprised to know that some of the questions are actually almost the way we were actually expecting. There will be ups and downs, definitely some grammatical error, some grammatical, what do you say, changes will be there, structure will be different, but the base content will be the what we have actually expected. So always try to simulate in your mind how this particular topic is actually going to come in the actual prelims as well as mains exam. That will be a huge help for you. So when we go to the next major, what do you say, details about this thing, we have to also understand about the different measures which the Indian government is actually taking. Also we will be focusing on the mission Indradhanush also. So what is the first remedial measure, or we can say preventive measure we are having? Again, for any other question, for any question, if that is being asked in the mains, make sure that you don't conclude it in a negative manner. So your conclusion should always be in like a solution or some suggestion. We can say way forward. Some proper conclusion should be there. So you cannot actually, if the UPSC asks you what are the major issues, one of the major diseases which the global or the world or the India is actually facing, you can list out the diseases. Don't end there. You can say that there are certain preventive measures or some solutions or some schemes and programs being there and which are actually going to counter these diseases. Full stop. So that is how you actually end a particular answer. So just like that, regarding this particular disease also, we have a national viral hepatitis control program which actually started in 2019. So we have a program like that, which is a national level program, and you can have the basic logic behind it to eliminate the hepatitis C in India, to reduce the burden by reduce the A, B, E burden, etc. So they're all taking about all the A to E hepatitis, and they are having a target of, for example, 2030 to eliminate the hepatitis C, which is actually very unrealistic target, but they are actually focusing on the hepatitis C, focusing on the year 2030, reduce the burden. That is the primary objective, we can actually say. So the next thing is actually about mission Indradhanush. So as you know, in the Indradhanush means what is it? Rainbow. So in the rainbow, we know that the colors are Vibgyor, right? Vibgyor means the 7 colors, starting from violet, indigo, orange, etc., like that. The blue, etc. So the Vibgyor means 7 colors, which means that the Indradhanush is also initially started to explore the 7 different diseases. So this particular Indradhanush, mission Indradhanush, is actually aiming for vaccination of the 7 diseases. That is why it is called mission Indradhanush. So in that mission Indradhanush, actually, why we are actually mentioning Indradhanush? This Indradhanush has a vaccination against hepatitis also. Hepatitis B mainly they are focusing, but they have a vaccination against hepatitis B also. So that is the point which we were actually raising. The last 2 points about the hepatitis is what are the symptoms, how it is spread. So we already discussed how hepatitis is actually spreading all the A, B, C, D, and E. So we'll talk about the symptoms and we'll go to the some portion of the mission in Indradhanush and wind up the topic. So when we go to the symptoms, it is actually very common things. For example, all the fever, the fatigue, for example, the loss of appetite. Appetite means hunger. So there won't be any hunger. I won't feel any hungry. So loss of appetite, the nausea, that is, I always feel like, vomiting. All the things will be there. All the general symptoms, which is for a fever, etc., like that. The point is, there is one catchphrase that is, there are a lot of people who has actually contacted the disease, who have the hepatitis, but there is no symptoms. So there are widely cases reported. For example, COVID-19. When the coronavirus COVID-19 was there, as you know that there were multiple people, there were many people who did not have any symptoms at all. Right, especially during the third wave and all, the Omicron wave and all, that virus variant was actually comparatively very mild than the Delta variant. Delta was extremely strong. So if you have Delta, you will most probably have some symptoms, you will have some issues, etc. But that the next wave after Delta was actually Omicron, and Omicron was actually very comparatively a mild wave. So a lot of people who did not who had the diseases, still they did not have any symptom, but still they were carriers. Right, I have the COVID, I have this particular hepatitis, but this thing will not show any symptoms on me. So what is the result actually? If I have that COVID Omicron, actually Omicron variant of COVID, I'll simply, I don't have any symptoms, right? So I don't have to doubt myself. I'll simply go into the public. What I'm actually doing, I'm actually spreading the disease to other people also. But in that other people, there will be some persons who are actually susceptible to this particular type of variant. So they will develop the symptoms. So they'll have issues. That is the problem. I will be a carrier even though I will not have a symptom. So the hepatitis also is exactly like that. There are certain people, there are different people who do not show any symptoms at all. That is also a point you have to keep in your mind. That is another statement which UPSC can create a statement out of it. That is, whenever you encounter hepatitis, the most of them will not show any symptom. Not like most of them, there will be some of them who does not show any symptom. So that is the point. And let's talk about the last topic, last subsection in the thing, that is the Mission Indradhanush. I'll just give you a brief understanding of Mission Indradhanush. So regarding the Mission Indradhanush program, we mentioned that it is actually for the 7 diseases. We'll understand which are the diseases are. So regarding this particular thing, Mission Indradhanush actually was started in 2014. That is the primary thing, which we don't, that date is actually not that much significant for us. What happened was that the government realized that the targets are not actually, being achieved extensively. So what they did, they actually reprogrammed this thing. So they created intensified Mission Indradhanush. So the word is intensified. The program was actually intensified. So intensified Mission Indradhanush was actually launched in 2018. And then further, there were actually regular updates out of it also. So now we are actually in the intensified Mission Indradhanush 5.0. So there were actually 4 more upgradations after the intensified Mission Indradhanush. So that is the point. Now, in the Mission intensified Mission Indradhanush, what are they aiming for? They are actually aiming for universal coverage of things. So we can say that it is a universal immunization program. So what is the goal of Mission Indradhanush, or what is the goal, what is the objective of such vaccination drive? It is universal immunization program. So that is what the goal is actually about, universal immunization program. The word itself is actually logic, right? Universally, everybody should be vaccinated, or everyone should have their immunization injections. That is the point. And even though they say universal, basically definitely it is implemented by the government of India. They are targeting the citizens of India only, the people of India only. They're actually looking, even though they say universal. So the other point is, who is the implementing or the major nodal ministry of it? We can say that it is actually the Ministry of Health and Family Welfare. So again, I'm just doing it in abbreviations only. And I have already told you this thing about the importance of abbreviations. Why we need such kind of abbreviation. When we see the word UIP, we already know that it is actually Universal Immunization Program. When we hear the word MOHF, which means that it is already Ministry of Health and Family Welfare. And this understanding of the abbreviations or the short forms are extremely important. Why? Because you have to write your notes. Well, and in the even the newspapers also, there are certain times in which they will not write the full words, etc. They'll only write the abbreviations. So if only you know the abbreviations perfectly, you can easily, swiftly, quickly read through the newspapers and journals. That is a very important thing. And the second thing is that to write notes also, you need abbreviations. So make use of the abbreviations the maximum amount of time. For example, the Chief Justice of India. You go to the Hindu newspaper, they'll write CJA only. So that is the point. Every newspaper, every journal, they want to conserve their space. They will be writing shortly. You also have the responsibility to read and write shortly so that your notes will be really concise. So that is why I'm trying to bring you that point of abbreviations. So it is actually the Ministry of Health and Family Welfare that is the basic nodal ministry implementing the particular scheme. But there are other ministries which are actually part of it. For example, Panchayati Raj system. So all the local self-government, the Ministry of Panchayati Raj is actually coordinating or tagging along with the particular program. And also there is Ministry of Women and Child Development also. So whenever we veterans like that, whenever we hear the word WCD, it is Women and Child Development. We know the abbreviation is that only. So Women and Child Development is there, and then Ministry of Housing and Urban Affairs. So all the the PMLA scheme or the Prime Minister's Housing Yojana, Awas Yojana, etc. Everything is being implemented. The urban, it is implemented by Ministry of Housing and Urban Affairs. So Ministry of Housing and Urban Affairs, and also not just that, also the I&B Ministry, that is Information and Broadcasting, that is I&B, Information and Broadcasting. So all the ministries come together to implement the mission Indradhanush because it needs a coordinated effort. It is focused. The nodal point is definitely Ministry of Health and Family Welfare. That is the point. Now, when we go into the last details of the particular topic, we have to see that what is the target of the mission Indradhanush. The target of mission Indradhanush is actually basically two kind of populations. So it is actually all the pregnant women. So it is all the pregnant women are the first target, and also all the children which are less than 2 years of age. So all of them should be immunized, that is vaccinated. So under 2 age children and all the pregnant women should be vaccinated, should have their immunization doses. That is the target of the mission Indradhanush. That is what they mean by complete immunization. And now the last point is we have to understand which are the diseases which are covered under mission Indradhanush. So we have to say that now it has been the mission Indradhanush is actually been expanded. Now there are 8 different diseases in which the mission Indradhanush is actually giving vaccines for. So what are the 8 diseases? It is actually listed in the left side. So this is an important thing. You have to keep a note out of it. You have to keep a slip note or maybe something like that, so that you can actually access it, so that you will remember which of the diseases are actually listed in it. So which are the diseases? One is actually diphtheria. I'm not going into the details, which is actually virus, which is bacteria, etc., like that. So please go through just go to the Wikipedia page. The first paragraph of that Wikipedia page itself is actually more than enough. So which are the diseases? Diphtheria, then there is whooping cough, and then there is actually Haemophilus influenza, that is like a fever. There are 2 types of Haemophilus influenza type B, that are pneumonia and meningitis. So meningitis and pneumonia, that are also considered as one. So Haemophilus influenza type B, then tetanus is actually there. There is tetanus vaccines, etc. there. Polio vaccine, we all have the polio vaccine when we were kids. Then TB vaccine, tuberculosis. Then there is measles, and last but not least, the topic here, hepatitis B. Note the point, B. There is no vaccine for C, and this mission Indradhanush is actually not giving vaccines for A, D, E, etc. They are giving hepatitis B only, while there is no C at all. So these are the 8 different diseases for which the immunization, the injections are actually being given. And also the 2 other updations we can say in the mission Indradhanush is that for the Japanese encephalitis, that is kind of a fever. It's a very acute disease. So for the Japanese encephalitis, the Indian government recognized that certain parts of the country are actually affected by the Japanese encephalitis. So what they're actually giving under the mission Indradhanush, certain districts are actually getting vaccination doses for Japanese encephalitis also, but it's not in the core list of diseases. And the next thing is about the rotavirus. So there is something called rotavirus, and the rotavirus vaccine is actually again introduced for Andhra, Haryana, Himachal, and Odisha. For the 4 different states in India, they have introduced the rotavirus vaccine. And some of the states, some of the districts and states, they have introduced Japanese encephalitis also. So combinedly, they are actually giving vaccines for around 10 different diseases. And one is actually counted as 2, that is pneumonia and meningitis actually considered as Haemophilus influenza type B. So combinedly 10 diseases are actually, we can actually list out in this particular mission Indradhanush.